short break, and my engineer told me that the output was not very bright, but we'll try to do something about it later. But the message, our listeners have received the message despite of the low output of that disc. Doctor, enlighten us about the laboratory services.
Okay, thank you, sir. Presently at the hospital, we have an upgraded laboratory that has one of the best facility, at least for this rural environment. We take lots of services that include chemistry, hematology, serology, and other tests, at least for the need of the hospital. We are not just there to give more of a head knowledge that, okay, you're sick, you're complaining of headache, maybe just take this, just take that. Everybody who complains of one thing or the other goes through tests, and that's why we have the laboratory. So we don't just keep the laboratory because, okay, we just want our hospital to beautify the hospital. But we keep it there to more like a partner. At least for a good hospital, you need a good laboratory. We have to carry out proper diagnosis of whatever a patient complains of. We just don't think from the head, okay, it looks like, we have to confirm it. So it's more of a confirmatory test of, oh, we have your samples, the patient complains of this, okay, we suspect this, let's have our test. We carry out our test. Our test will give us the direction that, oh, this is actually what is happening to the person. So that's why we have the laboratory, and we thank God things have been moving on fine. So we encourage people. Like, I would like to chip in. You see, in the life we see today, I don't expect to see people get married and complain, okay, our genotype doesn't match. These are simple things that you can just come to the hospital, get through the process from the record down through, then you get tested. Know your blood group, know your genotype. This is very important for everybody. In case of emergency, and we don't even know your blood group, we don't know your genotype, we can't just transfuse blood without knowing all these things. Especially your blood type is very important. You don't just transfuse blood from anybody and just think. We screen every blood. That's another thing. So it's not just like, okay, I have headache, I have this, I'm feeling feverish, I think it's malaria, I think it's typhoid. You just go to the chemist, you get drugs. No. You have to test. You have to be sure. Because when you go on with all these, take this drug, it gets to a point, it's more like you are abusing the use of drugs, and it tells on your system later in life. So I think with this, you now know the importance of having a laboratory in the hospital. Because most people feel, why should you have a laboratory in the hospital? But you can see the need for it. Thank you, sir.
Our time is fast running out. Can you briefly, what is your concluding remark on all the aspects we have told?
Okay, well, I would like to say a healthy life is a wealthy life. If you manage your health well, that means you will live well. But if you mismanage your health, then, I'm sorry, no matter how much you make, no matter the numbers of houses, cars, and all the luxury of life you acquire, once your health is lost, then you've lost everything. If you lose money, you can always work to get another one. But once your health is completely lost, then that means the life God has given you as a gift is lost. So I encourage us to visit the hospital. Some will tell you, I have no business at the hospital. Why should I be at the hospital? I'm not sick. It's normal for every human being alive to get to the hospital for normal body checkup. It's just like a car. You have a car, you need to drive to avoid disappointment. When you get there, you want to start your car and the car is not starting, you have to check with your mechanic. So also, if you want to live a healthy life, make sure you touch base with an healthcare facility for normal body checkup. Go there, check your high, make sure you know your high pressure, know the state of your teeth, know your vitals. Let them take total test and diagnosis of your system and be sure how well you are. While doing that, you'll be shocked that some of these hidden diseases might just be made exposed. And when it's exposed, the earlier you treat, the better. And you will be given proper counseling on how to take good care of yourself. So prevention is always better than cure, and it's also cheaper. So find time to visit, and I'm sure ECWA Hospital Egbe is one of the very good hospitals you can visit, and we'll be ready to welcome you. Find time to come, get serviced, and you enjoy a very good and healthy life. I wish us all very good and healthy life in this one life we have, and I pray that God will give us what it takes to manage our health well, because we understand the economic challenges in the country and even in this state. Thank you, sir.
Thank you, Doctor, for coming on the program.
Thank you.
It has been a nice time spent on the program. Remind our listeners your name once more.
Oh, I'm Dr. Samuel Fogbonjaiye from ECWA Hospital Egbe. Thank you.
Good news for the good people of their community and environment. ECWA Hospital Egbe offers safe and affordable child delivery and maternity care. No need for traditional home birth. Licensed doctors, midwives, and nurses ensure pregnant maternity care. No need for traditional home birth. Licensed doctors, midwives, and nurses ensure pregnant maternity care. No need for traditional home birth. Licensed doctors, midwives, and nurses ensure pregnant maternity care. No need for traditional home birth. Licensed doctors, midwives, and nurses ensure pregnant maternity care. No need for traditional